you can appreciate the surgical shunts in the first diagram A. You can see that this was a portal vein and this was inferior vena cava. So portocaval shunt. This is the side to side shunting, and this is end to side, end of the portal vein and side of the inferior vena cava. So again, this is an example of surgical shunt, and this is a inferior mesenteric vein and the this is the inferior vena cava. So mesocaval shunt, and this is the spleno-renal shunt. So spleno-renal shunt. Now these were the surgical shunts, and the main objective of these shunts was to divert the blood flow from the portal system towards the systemic or the inferior vena cava. Now the ascites. Ascites are the accumulation of free peritoneal fluid, and it is a common feature of advanced liver disease. The patients suffering from the chronic liver disease, in which the one of the terminal event is the presence of these ascites. It is independent of the etiology, so the end result of various etiologies that has led to the development of chronic liver disease. This is the end sequel of the most of the pathologies of the liver. Fluid accumulation is usually associated with abdominal discomfort and a dragging sensation. So most of the time this is associated with abdominal distension with some discomfort. The other symptoms like the pain and these are not present in these individuals. Now determining the cause of the ascites is possible with the help of ultrasound and CT scan. These imaging studies will help about the texture of the liver, and most of the time it is irregular and cirrhotic. Then the portal vein patency, most of the time with patients with chronic liver disease. The portal vein is thrombosed, splenomegaly of the cirrhosis. Then there is a splenomegaly is also associated, and we can appreciate with the help of ultrasound and CT scan. Diagnostic tap or aspiration is done in order to know about the culture and microscopy if there are infections and super infections are present in the ascites. Protein content, it will help regarding the transudative or exudative type of the ascites, and cytology will tell about the presence or absence of the malignant cells and amylase level. Of course, in some cases when there is acute pancreatitis and there is ascites, so it will help in establishing the differentials. Treatment of the ascites in chronic liver disease. There are certain general measures that includes the salt restrictions and the diet that are rich in salt. They are, you can say, we ask the patient to avoid these salt rich foods. Salt restriction is one of the, because the fluid is retained in the presence of salt, especially sodium. Diuretics are usually is the first mode of treatment and first line of treatment for the patients with ascites. Furosemide is given, and there is a recommended dose twice a day, in the morning and at the noon. Then abdominal paracentesis. This is the therapeutic tap. It means that we insert some LP needle or some cannula in the abdominal cavity, and then it is attached with the tubing system. So whole of the fluid in the abdominal cavity, it is you can aspirate it in larger amount. This is done mainly for the patients who are having very tense abdomen and difficulty in the routine activities. And the patients who do not respond to the diuretic treatment and they need repeated percutaneous aspiration. This procedure, abdominal paracentesis, is combined with volume replacement. It means we have to give the fluid while doing this therapeutic aspiration. Salt poor or standard human albumin solution dependent on the serum sodium level. So this is the theme to retain the fluid in intravascular compartment. We have to give the albumin in order to maintain the fluid in the vascular compartment. Now the surgical aspects of this treatment of the ascites and the important procedure and important method for diverting this method is peritoneovenous shunting. So what does happen in this special surgical method? One end of the celastic tube is inserted into the ascites within the peritoneal cavity, and the other end is tunneled subcutaneous to the neck. So what happens that we can do this procedure laparoscopically or with the open standard laparotomy procedure. We open the abdominal cavity and put the drain in the abdominal cavity, and then a tunnel is made in the chest cavity just behind the sternum, and then finally in the neck it is this drain that was initially placed in the abdominal cavity, tunnel into the chest, and then finally it is placed in the internal jugular vein. So you can say we have a diversion of this fluid directly into the veins. In order to reverse the backward flow, usually this tube is provided with a valvular mechanism. So there is a valve within the tube, and that prevents the backward flow. So now another technique for the ascites is a transjugular intrahepatic portosystemic shunts. These are methods initially that were used for the treatment of the esophageal varices. It is also may be helpful in some cases of the relief of the fever symptom of the ascites. So it was studied that when it was used in the patients who had portal hypertension, and initially given for these cases, in these patients they have also got relief of the ascites, associated ascites. So now the liver transplantation, another you can say very important discussion we have discussed while discussing the neoplastic lesions and hepatic cell carcinoma. In detail we discussed about the liver transplant. Now one of the indication for the liver transplant is ascites. So in a patient who is suffering from the chronic liver disease and decompensated liver disease, we can have this liver transplantation done for that individual. Now this was the indication. We have already discussed the criteria for the liver transplant, and patient's performance status, underlying etiology of the liver disease, and associated medical problem will be the major factor determining suitability for the liver transplant, because it is a you can say very demanding procedures and associated with so many morbidities. Mortality rate is very higher in this procedure, so we should have these things done before surgery, so that the patient that is have been transplanted will get maximum advantage. This was all about the lecture, and I hope I have conveyed the message regarding the portal hypertension, esophageal varices, and the treatment of the surgical aspects of the ascites. And any question you can ask me in the comment section. Stay safe and healthy. Allah Hafiz.